Hello everyone. So we have already seen about two topics from this fixed partial dentures. Moving on towards the third topic, that is the abutment selection in fixed partial dentures. So the most important factor to be considered in the design of fixed prosthesis is the location and the characteristics of the abutment. So now what is abutment? So abutment, it is defined as it is a tooth, a portion of a tooth or a portion of an implant which is used for the support of the fixed or the removable prosthesis. So now over here, this is the edentulous space and these are your natural teeth which are present. So these natural teeth, they act as the abutment through which the fixed prosthesis, they will get the support for the denture. The choice of a suitable abutment, it is very important because the abutment, they has to withstand both the forces which are acting on it and the forces which are acting on the pontic. So your abutment, they have to carry both the forces, that are your forces which are acting on your fixed prosthesis and the forces which are acting on the tooth itself. So Johnston, he proposed 19 different factors that control the design of the fixed partial denture. So these 19 factors, they are used to select the abutment, like how your abutment it should be for the proper design of the fixed partial denture. So now this, it is just a mnemonic how you can remember your 19 factors, because 19 factors, remembering them at a time is very difficult. So you can like just remember this mnemonic and like we remember some pin. So like this you have to just remember 3, 5, 2, 5 and then 4 times 1. So this is the mnemonic is CAMP, C-A-M-P, CAMP, ROSE, R-O-S-E. So now here I have written 3. That means there are 3 factors which are starting with C. So those are the crown form, crown length and the crown root ratio. Over here it is A. So A, so there are 5. So there are 5 factors which are starting with A. So those are the Ante's law, axial alignment, arch form, alveolar ridge form and the age. Then the M is, so there are 2 things which are starting with M. That is mutilation and mobility. Now P again is 5. So that means there are 5 factors which are starting with P. That are your periodontal health, pulpal health, psychology, phonetics and prognosis. So this is the first part, that is your CAMP, C-A-M-P, and the pin like you can remember is 3, 5, 2, 5. So there are 3 things with C, 5 things with A, 2 things with M and 5 things again with P. Now the next is, so over here now you can see when you will calculate it, so the numbers is equal to 15. So we have seen like earlier that there are 19 factors. So now remaining 4 are, so R, O, S, E. So those are like 1 factors in each of this letter. So R is for root length and form, O is for occlusion, S is for span length and E is for aesthetics. So these are your like factors for the abutment selection. So now starting with the first one, that is the crown form. So it is like if the neighboring teeth, they have tall cusp and well designed morphology, so we have to anticipate an additional lateral load on the abutment teeth. So now if your abutment, they have like tall cusps. So if the cusps are tall and they are having well defined morphology, so in that case you can like anticipate additional load on this abutment because they are well designed. The next is the if the pontics, they have larger occlusal table then the abutment, so in that case you require additional abutments. So if now this is your like pontic, the tooth which is to be replaced in that edentulous arch. So now if your occlusal table of this pontic, it is larger than the occlusal table of your abutments, so in that case you have to include like 1 more abutment. Like in traditional thing we use a 3-unit fixed partial denture. But if your occlusal table of the pontic, it is larger, so you will use a 4-unit in which there are 3 abutments. So this is the first one. Now starting with the second, that is the crown length. So it signifies the clinical crown length. That means if the patient, they have recession, so in that case the teeth, they will have a taller crown. So in this case now you can see there is this recession. So this is the recession. So this is a normal case and this is a recession. So in recession, obviously your clinical crown, it will look longer. So you have to consider that and not just the crown which you can see above the CEJ. You have to consider everything which you can see even if it is below the CEJ. So your crown length, it is signifying the clinical, like what clinically you can see. So if there is recession, that means they have a taller crown and with compromised root support. Now for the abutment selection, you mainly require a good root support. And in the recession case, you'll see there are taller crowns. So because of that, there are more torsional loads which are acted on the abutments, and because of this, there are more stresses which are acted on the abutments. So hence, the Pontic with increased occlusogingival height will require additional abutments. So that means you require an additional abutment in this case. Now the next is, if the abutment teeth, they have less than 4 mm of the crown structure, in that case again you require a additional support. So this is about the crown length. The next one is the crown root ratio. Now in this, the root support, it should always be greater than the crown height. Now as I said, we require the most of the support from the root rather than the crown. So in this, the root, they should be greater than the crown height. So ideally the crown root ratio, it should be 2:3. But now it is not ideally always seen. So we are accepting if the crown and the root, they have the ratio of 1:1. So crown root ratio, it is nothing but it is a ratio between the length of your crown and the length of the root, and it should always be less than 1. So if this root ratio, crown root ratio, it is more than 1, so it is unacceptable. The next is the Ante's law. Now about this Ante's law, I have already made a video, so I am linking that down in the description box. So go and see what exactly this Ante's law is. So I am just going to say about this definition what it says. So it says that the total perisegmental area of the abutment teeth, it should be equal to or it should be greater than the perisegmental area of the missing teeth. Next one is the arch form. So the teeth like canine and first molar, so they can be used as abutment for distributing forces in the wider arches. Because the canine, it is a cornerstone tooth, and the canine replacement fixed partial denture, it is subjected to more forces because the canine, it forms the curve of the arch and it tends to lie outside the interabutment axis. So that means if the teeth, they are acutely curved, so in that case again you need to add additional abutment. Now the next is the alveolar ridge form. So in this, a wide and a flat ridges are ideal for the FPDs. So if a thin and a low ridges, they are due to severe resorption, they increase the pontic height, and because of that there is increase in the torsional loads on the abutment teeth. So the abutment teeth, they should have a good trabecular pattern. So that means if you want your teeth to be act as an abutment, so they should have good alveolar ridge support. The next one is the axial alignment. So the term axial alignment, it refers to the long axis of the abutment teeth to each other. So a tilt up to 25 degrees, it can be accommodated by modifying a tooth preparation for a full veneer preparation, and you can tilt it up to 15 degrees to accommodate a resin bonded bridges. So a tilt is nothing but the long axis of your abutment teeth. So that means your abutment, they can be tilted mesially or distally. So what is this now? Tilted molar abutment. So now selecting a mandibular molar abutment is more challenging because they are oftenly mesially tilted. So the treatment can be, so these four are the treatment modalities. If your molar, it is mesially tilted, that is your mandibular molar. So in that case, you can do orthodontic treatment, or you can use a half mesial crown or a telescopic crown, or you can use a cross spin and wing pontic. Now about this tilted molar abutment, I am going to cover in the video of types of abutment. The next thing in this axial alignment is the crowding and the rotation. So if the abutment teeth, they are crowded and they are out of the arch, then either a partial veneer crown, it should be placed, or the crown should be modified after the root canal therapy. So in severe cases, the tooth, it should be extracted and then they are replaced from the next eligible abutment. So that means if the teeth or the abutment, they are crowded, so you can use a partial veneer crown. And if this is a severe case, so if they are severely crowded, in that case you have to go for the extraction of that abutment. So you have to use the adjacent abutment that is eligible. So this is about the axial alignment. That means if your tooth is the abutment, it is tilted, or if there is crowding which is present. The next factor is age. So in young patients, a high degree of aesthetic is required. So resin bonded bridges, it can be provided for such patients. So as the patient, they are young, so obviously aesthetics, they are of more concern. So in this case, what you can do is you can use a resin bonded bridges. Now the next thing in young is, so if your young individuals, they have teeth with large pulp chambers, and because of that, now we know we are doing the tooth preparation of your abutments. So if the pulp chamber, so if your pulp chamber is larger, so in that case there are chances that the pulp, it will get exposed. So you have to tell about it to the patient earlier. Now in elder patient, you will see the older individual, they have darker with layers of reparative and sclerotic dentine with reduced pulp chamber. So more amount of tooth structure, it can be reduced without the fear of the pulpal exposure. Now we have seen now in young, the pulpal chambers, they are large. So there is chances that the pulp, it will get exposed. Whereas in adult, as there is with time the formation of the sclerotic and reparative dentine, so because of that the pulpal chamber, it will get shortened, and because of that only there are like less chances of pulp of getting exposed. Now there are more incidents of cervical abrasions and the shortened crown due to atresion if the patient, he is an elderly patient. So in that case you have to see, you have to like additionally add a abutment to support the prosthesis. Mutilation. So mutilation is the abutment teeth, they should have a height of at least 4 mm. So you should have at least 4 mm height. So if the height, it is less than 4 mm, so in that case a core buildup with composite resin, it should be done. So in this case, if it is less than 4 mm, so you have to do core buildup. Now if the height, it is less than 2 mm, so in that case you have to go for post and core along with the crown lengthening procedure. And if the decay, it extends into the root surface of the abutment, then that teeth, it should be extracted and it is never going to be used as a abutment. So you have to just remember these 4 points, like the height, it should be 4 mm. If it is less than 4 mm, then you have to go for core buildup. If it is less than 2 mm, then you have to go for post and core and the crown lengthening procedure. Now if you see the decay, it has reached your root surface. So in that case you have to extract that tooth, and this tooth, obviously it cannot be used as a abutment. Now the next is the mobility. So teeth with firm periodontal support, they are used as an ideal abutment. So if you will see there is grade 1 mobility, so in that case you can do splinting and you can add an additional abutment for the support. Whereas if you see there is grade 2 mobility, so in that case such tooth, it is contraindicated as an abutment for FPD, because you require a firm support, firm periodontal support to be used as an abutment. Now the next is the periodontal health. So a periodontally compromised teeth, it can never be used or it is never selected as an abutment. Now if the tooth, it has a bone loss, but the periodontal condition, it is stable and it is not mobile, so in that case you can use that tooth as an abutment. So this is about the periodontal health. Now the pulpal health, it says that the FPD abutment, they should preferably be a vital teeth to have a better proprioception. So if your tooth is vital, so because of that you will have better proprioception. So this is just an ideal case. So if there is like severe atresion, so in that case you have to go for prophylactic root canal therapy, because now again if there is atresion, there are more chances of pulp exposure. So basically you have to go for root canal after that. So if there is severe atresion, so you are like prophylactically only going for a root canal therapy and then you are using it as a abutment. So in this case, a partial veneer crowns, they are preferred for a vital abutment, so that the vitality testing and the health can be evaluated after cementation of the prosthesis. So if it is a vital tooth, so again you are going for a partial veneer crowns. The next one is psychology. So patient with mental disability, they require multiple splinted abutment rather than the individual crown, because they have like mental retardation. So they cannot maintain the good oral hygiene. So in that case you require an additional abutment. And patient with neurogenic stress, so because of that they are more prone to bruxism, and because of that again there is atresion which you will see, and in that case again you have to go for additional abutments. Now the next factor is phonetics. So abutment with FPD retainers, they are generally bulkier than the natural counterparts. So in this case, now this can affect the phonetics. Now if your retainers, they are bulkier, so obviously it will affect the phonetics of the patient, like the patient, they cannot talk properly. So in such conditions, it is beneficial to avoid an anterior abutment, and you have to build a spring cantilever FPD using a posterior abutment. So this is a picture for a spring cantilever. So what exactly the spring cantilever is? So spring cantilever is when you have the abutment only on one side. So the ideal is when you have abutments on both the side of the denture space. So cantilever is when you have abutment only on one side, and in spring is when the denture space, it is not adjacent to your abutment. So in this, now we have to replace this 2-1. So a spring cantilever, it is constructed in such case. That means you have to take the support or the abutment as a premolar, and this is your missing teeth, and you join them with the help of a loop connector. So this is nothing but a spring cantilever diagnosis. So generally FPD, they are designed to last 60% of the time over a period of 20 years. So your ideal FPD, it should like last for at least 20 years. So if the abutment health is compromised such that it will not last this long, so in that case you have to avoid that abutment. So if you think your abutment, it cannot last for at least 20 years, so in that case you are not using this abutment. The next is the span length. So span length is nothing but the number of missing teeth in that particular area. So long span FPD, they undergo greater flexion. So 5 unit flex is around like 27 times more than the 3 unit, which means like if you have to replace more than 3 posterior teeth, so in that case you have to add additional abutments, because the teeth, now the forces which are acting on your abutment, they will be more, because there are more edentulous spaces which is seen. So there are more teeth which are absent in this area. So because of that, what you have to do is you have to add additional abutments. Now the next factor is the root length and form. So longer root like canine, they have excellent, so they can act like a excellent abutments. So in this case, now we have like already seen in the crown root ratio. So your root, it should be longer than the crown. So now your canines, they have longer root. So because of that, your canine, they act as a excellent abutment, because usually they have this 2:3, that is your ideal crown root ratio. Now the anterior teeth, they have triangular roots, and because of that they can withstand the lateral load, whereas the posterior teeth, they are cylindrical in shape. So because of that, your posterior teeth, they can withstand the vertical load, whereas your anterior, they can withstand the lateral loads. Now your curved root, they often have better anchorage, and they may serve as a better abutment. So if the roots, they are curved, so they are considered to be a better abutment. So this is about the root length, and the form. Length is your longer roots are better abutment, and the form is the curved root, they have like they are a better abutment. Now the next is the occlusion. So now depending on the occlusion, the abutment, it can be selected. So for FPD with mutually protected occlusion, so your occlusion is good, so in that case minimal lateral load is expected, and so a single abutment, it should be sufficient on each side. That is your like ideal 3 unit case. So in which you are using one abutment on one side and one abutment on the other side. If the occlusion is good, so in this case only you can use this ideal 3 units FPD. But now if the patient, they have parafunctional habits, so in that case you have to add a abutment if they have any parafunctional habit. Now if the patient, they are suffering from trauma from occlusion, so in that the abutment, they should be splintered with the additional or the secondary retainer to support that FPD if the patient, they have trauma from occlusion. Now the next factor and the last factor is aesthetics. So now in this, long connectors in the anterior abutment, they can be aesthetically compromising. So you have to not use long connectors in the anterior region, because they don't act as a aesthetic thing. The next is a resin bonded retainers, they again act as anesthetic, because in resin you will see there is metal which is shown. So because of that, they are anesthetic. And the next one is, if there is a diastema, then the loop connector, it can be used to join the adjacent abutment. So if the anterior abutment, they are compromised, good aesthetics can also be obtained using a spring cantilever abutment. So in anterior you can use this spring cantilever abutment. So this is about the aesthetics. So this was all about the abutment selection and the 19 factors which are important in the selection of the abutment. I hope you found this video helpful, and if you did, then please like, comment if you have any doubts about this, and do share with your friends, and do subscribe to my channel. Thank you so much.